This is a software demonstration for the Spine 3D LiDAR machine by Sensor Medica. This particular patient is a fit male in his early 40s with a physical job, but has long-term thoracolumbar, thoracic, and neck discomfort with potential cervicogenic headache. Firstly, we can view the skin image and the concavity, the two automatically preset sections to a Spine 3D scan. We can view in deep grey or deep color. Deep color is quite good at showing rotations, muscle imbalances, pelvic obliquity, etc., etc. You can hide and reveal different components, and the same applies on this image. Sometimes you can see a rotation or a distortion. The patient can't always see that, so we can add and subtract the standardized data, which is a visual representation of the numbers. And this one is particularly here showing rotation. But you can sometimes see that the spine is getting in the way. When you take this section off, you can see there's a clearer amount of rotation in this area. And a counter rotation higher up. You can remove the thoracic. And whilst mild, this gentleman who has a physical job, his symptoms do correlate with the thoracolumbar junction. It does actually completely match. He has a pelvic obliquity here. A mild balance, not enough to be a scoliosis, but something to keep an eye on. This can be caused functionally through muscle imbalance, etc., of course. Sagittally, you can see that he does actually have quite a pronounced upper thoracic kyphosis. A slightly increased upper thoracic kyphosis angle is demonstrated here. And you can see that there's an unevenness to that thoracic curve. There's a sudden oblique change around the T789 region. This may have been caused by previous trauma, but it will definitely put an extra stress on that TL junction. We have already observed a mild degree of rotation on the other images, but this cross-sectional view is very, very good for demonstrating that. You can add these points on, which are the vertebral prominence at C71. They're the shoulders. Then we can actually point in the PSIS, which are classed as dimples left and right on here. And they can stay as a constant. So you can see that his shoulders and pelvis are relatively level, but there is a small degree of rotation between that. And that's going to be creating a lot of pressure within his spine on a rotational component. You can measure various different things, or look at his center of gravity in relation to something that interests you on one side in particular.